Namaste, this is Dr. Meenakshi, MDIU, Kamarabritya. So today I am with the topic breastfeeding, which is very necessary for newborns and new mothers, right? So what is this breastfeeding? Especially the feeding of a breast milk to a newborn from birth till 6 months should be exclusively breast milk. Then later after 6 months you can wean. Weaning means you can give a compensatory food or any semi solids to a baby with breast milk till 1.5 to 2 years. If the baby is fed with breast milk till 2 years from the day of birth, then such babies will be having many beneficial effects or results in their health. So behalf of that, we will see what are the benefits of this breastfeeding, why we should give breastfeeding, because nowadays has the women will be working, so most of them will stop breast milk to their babies too early, that is 6 months, 5 months before that also. And also some mothers will not even breastfeed for not they are working, but they feel that their breast shape will go like that. Means now has the technology developed or has the fashionable world developed, many women have misconception in their mind about feeding breast milk, right? So we'll see what are the benefits of this breastfeeding. And one more thing, as we are explaining benefits of breast milk, in conditions like that, as I said, women who wantedly they will stop breast milk, for them it's necessary to understand. But the women who are willing for the breastfeeding, but the breast milk is not sufficient for the baby, or maybe the lack of breast milk may be in their production, in such cases it's not compulsory or it's inevitable condition, the mothers can't do anything, right? So in such conditions you can go for artificial feeds. But the today's topic we have to understand is what are the beneficial factors about breast milk. We'll start the topic with the common benefits of the breast milk. What are the common benefits of the breast milk? This breast milk promotes infant immunity specially, and nurtures the mothers and babies bonding, emotional bonding, and most common point is cost effective. It is free of cost, right? You know, you don't need to any purchase or spend some money for breastfeeding. It's free of cost and it's environmental friendly, as it is natural process, and it works as a contraceptive in few women. When the mother is exclusively breast milk, the study have gave a result that it acts as a contraceptive in women and it induces oxytocin production. So these all are the common benefits of the breast milk. And coming for the special benefits of the breast milk, particularly in mom and for baby. For mom also have some beneficial points by breastfeeding. That is, while breastfeeding, women lose her extra calories per day by breastfeeding a baby. So by this, with the help of burning extra calories, she can go to pre-pregnancy weight as early as possible. And women who breastfeed, they have the low risk of breast cancer and ovarian cancers. And the special point is, by breastfeeding, women will have low risk of postpartum depression after delivery, and mainly they will be having emotional bonding with the baby. These are the benefits for the mom. Coming for special benefits for a baby by breast milk are, the breast milk is rich in nutrition specially, so there will be no any case of malnutrition in a baby. The baby will get all the nutritions whichever the baby is needed for the health, and especially the antibodies like IgG, IgM will be given for baby from breast milk. So antibodies will be prepared in a baby's body to fight against the infections or diseases. And studies has proven that the exclusively breastfed babies won't become obese, and the exclusively breastfed babies won't go for the ill health issues like allergies, ear infections, respiratory infections. These all will be having lower risk factor in a breastfed babies, exclusively breastfed babies. So these are the special points which the baby get through the breast milk. So everything, every point, it may be health issues or it may be the other diet issues. Wherever we have the positive points, with that vice versa we will be having negative points also, right? By comparing that, this breastfeeding has some common breastfeeding problems, like mother may have the nipple crack, especially the new mother, first time mother will be having nipple crack due to breastfeeding, and breast engorgement means due to collection of the breast they will be having the pain and heaviness of a breast, and in some women will be having low breast milk supply, or and in some women will be having overabundant supply of breast milk. These are the common problems. For cracked nipples, coming for the desi tips like home remedies, you can apply desi ghee or any moisturizer when baby is sleeping, and you can wash it off while applying while giving the feed. If you apply desi ghee, no need to wash, you can give directly, it's good only. Coming for the engorgement of the breast, if it's very painful, then you can express the breast milk when you should express, not whenever you want or whenever you are feeling uncomfort. After feeding a baby also, if your breast is paining, then you can go for expression of milk. And in low supply of breast milk, you can consult your gynecologist, and you can have a medicines. Now as technology is developed, many in all fields we will get the medicine to get the results. So many medicines are there which will get the results, maybe in Ayurveda or maybe in modern, you can go for the medicines. For example, in Ayurveda, Shatavari granules are very good for the milk supply. You can have that. With that, 1 glass of milk you should have 2 times. With 1 spoon of Shatavari granules, 1 glass of milk you can have. It's having very good results in supply of milk. And coming for next point, that is maybe the risk factors. What you will get the risk factors if you feed a artificial feeding. The first most point in the high risk of artificial feeding is bonding. The emotional bonding will be lowered. It's not that there will be no bonding only. There will be bonding. However, the baby will be yours only, and your only will be the mother. But the emotional bondings which we get from breastfeeding will be hampered, first thing. And in coming for health issues, there will be high risk of diarrhea and respiratory infections in artificial fed babies. And as we know, in breast milk there will be all nutritious supplements, right? So in coming for artificial feeding, there may be the chance of malnutrition in babies. And in artificial feeding, there will be high risk of chronic diseases in babies due to infections, because as we feed, the way of feeding is bottle feeding, right? I will explain in next point why there will be chronic diseases for artificial feeding, not all babies but some, but that some why I'll explain in next point. And the next point is IQ level will be low in artificial feedings, and there will be high risk of anemia. These all will be point of the artificial feeding babies, what they may suffer. And next, coming for the point why we will get this all high risk factors by artificial feeding is especially in bottle feeds, because now the first thing is, if we are feeding artificial feeding, it's high of cost, and it's time consuming, because we should hygiene a bottle, we should sterile a bottle, we should sterile a nipple, everything. It's time consuming. And also, if you didn't sterile these bottles, feeding bottles, or if you use the infected bottles, something else like this, then these all points will cause ill health in a baby. By that, there will be the risk factors like diarrhea, maybe the IQ level, everything. All the risk factors will be caused by mistakes of handling the artificial feeding bottles. Rather than that, nowadays all formula powders they prepared by comparing the breast milk, whatever, it's almost nearer for the breast milk nutrients, but the bonding will be bonding only. So we should maintain here, if we are in some situations like there is no breast milk or there is lack of breast milk, it's not sufficient, when we are going for artificial feeding, we should maintain the points like hygienic and steriling bottle. These all points we should maintain. And rather than that, if you are having sufficient breast milk, then too you are avoiding, then it's wrong. Please go for breastfeeding till 6 months, exclusively breast milk. Later you can feed according to the baby's demand after weaning, that is supplementary foods, till 1.5 to 2 years. So 1st August to 7th August, it's breastfeeding, World Breastfeeding Week. Why they kept? To encourage a newborn, new women or a new mothers to breastfeed their babies. So thank you.